Yes, Gregg Gonsalves is an associate professor of epidemiology at Yale School of Public Health. Dr. Gonsalves is an expert in policy modeling on infectious diseases and substance use, as well as the intersection of public policy and health equity. His research focuses on the use of quantitative models of improving the response to epidemic disease. For more than 30 years, he worked on HIVs and other global health issues with several organizations, including the AIDS Coalition to Unleash Power, ACT UP, the Treatment Action Group, Gay Men's Health Crisis, and the AIDS and Rights Alliance for Southern Africa. He is currently public health correspondent for the Nation, and Gregg will speak on, we'll talk on the financialization of medicine and the medicalization of public health. Gregg, please, if you would share.
Hey, everybody. So I have an article coming out tomorrow in the Nation, which is basically what I'm going to say tonight. So if I go quickly through all this, you can read my more coherent thoughts, probably around 5 or 6 in the morning. But, you know, most of us know that the injustices at the heart of the American healthcare system are clear to any of us who has eyes and common sense. But the need for reform is equally apparent, but the status quo has been well defended, and we haven't seen any real change over the decades. And we could make the case that even before COVID, things were getting appreciably worse over the past decades. So, you know, I've been incredibly cranky and angry throughout the pandemic, but, you know, what I want to talk a little bit about right now is where I see some hope emerging, which, you know, from people who know me, may seem like an odd departure in my from my sort of vitriolic state of normal. But, you know, 3 things happened over the past week in sort of popular mainstream media and in scientific publications, which gave me a sense that there are cracks in the foundation, maybe there are little rays of lights and shoots of green that are happening. One was, some of you know Eric Reinhardt, who's a psychoanalyst and physician, who wrote a piece in the New York Times about physician burnout last week. It wasn't about physician burnout. It was really about a system of healthcare in the United States that is so extractive and exploitive that it's really crushing the souls of physicians, nurses, and other healthcare practitioners who go to serve and to cure, but are really end up defending healthcare as a business venture because doctors believe that if healthcare were made a public service, they'd lose their professional autonomy and make less money, is what Eric says in his piece. But what was exciting to see in the pages of the New York Times, reactionary publication that it is that Eric calls for something more than sort of a diagnosis. He says, look, we've got to organize, and we have to reorganize our medical system, but we're gonna have to organize ourselves too. And makes a case for frankly unionization in the pages of the New York Times. Great. You know, then I opened the Journal of the American Medical Association and saw Don Berwick's piece that came out around the same time, maybe a little bit later, called Salve Lucrum, the existential threat of greed in US healthcare. Now, this guy was the former head of CMS. You know, he ran the Institute for Healthcare Improvement. He's no sort of, fire-breathing radical, but really made a case that that the glorification of profit is harming both care and health in the United States, and that he asked for healthcare workers to get noisy and really take on the unchecked greed in American medicine. So great. We have 2 people speaking out in major platforms about sort of the rot at the soul of American medicine. And then there's a quieter piece by a couple of 3 doctors, Suhas Gandhi, Sanjay Kishore, and J. Michael McWilliams in the Journal of General Internal Medicine. And what was interesting is they looked at the who runs the top 20 hospitals in the United States. And what they found is that over half, 56% of the board members at these hospitals were from the financial industry or from business, and 15% had clinical training or from the healthcare services sector. So, while Eric and Don Berwick speak about greed in the context of American medicine, these 3 other physicians say, actually, if you want to know where it comes from the leadership, and a fish rots from the head down. Now, why should we care? We just heard Rupert talk about deep medicine. In the context of public health, I think of them as social determinants of health, right? That make up close to 80 to 90% of health outcomes on a population level in the United States and around the world. It's only 10 to 20% of our fates that are tied to clinical interventions and clinical factors, right? So we pay for a lot of healthcare. We pay for very little public health in America, right? And so if we've seen the financialization of healthcare and this sort of rapaciousness of the profit motive, we've also seen medicalization of public health, right? And what we've seen in the context of the COVID pandemic is really a shift to the individual level. You do you, individual risk and individual choice, from David Lenhart or Lena Wen. But this made me think that, you know, this financialization of the medical profession really has to be seen side by side with the medicalization of public health, in which the unbillable social determinants of health need to be absorbed, or if you cannot absorb or compromise it through medicalization of public health, you have to destroy it. And when we think about what has happened over the past few years that Rob discusses in his book, it's really a larger fight for the soul of American medicine and the survival of public health. And so when doctors Reinhardt, Berwick, Gondik, Charest, and McWilliams talk about the need to organize, we need to take it seriously. And if it's coming from inside the house, we have to figure out how to support healthcare workers, because the money and the power are there, right? Public health is always going to be a poor stepchild of American health. But if we can build a union of doctors, nurses, orderlies, other people working in the health sector, those of us in public health can join them, and we can maybe have the revolution that we've been waiting for.